bleeding during pregnancy. Today, we have with us Dr. Sonia Naik to tell us more about why does bleeding occur during pregnancy and what precautions does the mom need to take in case you have bleeding during pregnancy. Dr. Naik, we'd first like to know, is it normal to have bleeding during pregnancy and what causes bleeding in pregnancy?
Any bleeding during pregnancy is considered as abnormal unless and until the cause is identified. So first we'll say always that it is abnormal. But once we've identified the cause, then we'll see if it is normal and abnormal. So normal pregnancy bleeding means it's an implantation bleeding. Implantation bleeding happens till the 14th to 16th week of pregnancy sometimes. And it gets basically because of the embryo implanting into the uterine cavity, making its bed inside. Now these causes can be pregnancy related, they can be non-pregnancy related also. So when I say non-pregnancy related, it means she can actually have a growth on the mouth of the uterus, that's the cervix, so there can be a cervical polyp. The cervix can be so congested, which happens during pregnancy, which is very normal for pregnancy, and post intercourse sometimes the cervix can bleed, so that can be a cause of the bleeding. The causes can also be pregnancy related. Pregnancy related causes will be different in the first or the second trimester and very different in the third trimester. So if it happens in the early pregnancy, we are a little doubtful about how the pregnancy is going on. So one is a threatened miscarriage, then there can be a missed abortion. That means the pregnancy stops growing. So that's again causes sometimes bleeding. Then sometimes there can be a molar pregnancy. That's again a different sort of a pregnancy, abnormal pregnancy. So that also causes bleeding. These are the features which can happen during the early pregnancy. Then the causes during the later part of the pregnancy can be different. Like most of the causes during the later pregnancy are placenta related. Sometimes the placenta separates prematurely. It starts separating prematurely during pregnancy. So we call it as an abrupture placenta, means it's separated from the uterus and it causes bleeding. The placenta can be low lying. It's in the lower part of the uterus or in the mouth of the uterus, in the cervix. So we call it as a placenta previa. That can also cause bleeding. And the most important is we have to make sure that the patient is not in labor. Sometimes the mother is in labor and that is actually causing bleeding, which can be a preterm labor, which can be a term labor, depending on what stage of pregnancy she's coming with bleeding.
What should a mom do if she discovers that she's having bleeding in pregnancy?
So the first step is inform your doctor, go to the hospital, see the doctor. That's the first step. Then the doctor sometimes does an internal checkup depending on what sort of a history and what sort of a bleeding that happens accordingly. And the most important diagnostic tool is the ultrasound. So all these things are done to make sure that the pregnancy is normal, and then depending on the source of the bleeding, she is managed.
And what special care or precaution does a mom who is observing bleeding during pregnancy need to take care of?
General precaution is restricted activities unless and until there is a risk of preterm labor or the cervix is loosening up or opening up.
People also believe that bleeding could be periods. Is it possible to have periods during pregnancy?
So it's not possible to have periods during pregnancy. So the implantation bleeding is only the sort of bleeding which is actually considered to be periods. Sometimes it coincides with the dates of the periods and people think there's actually the period still happening, but it's the implantation bleeding which is actually happening.
Don't forget to subscribe to our channel to get more information on videos like this. And do share this video with your friends or family who may benefit from the same.